Hello everyone, my name is Charmidale Blanco, a student nurse from BSN1 11D, and today I am going to demonstrate the assessment of the thorax. Thorax is a part of the body between the neck and the abdomen, including the cavity enclosed by the ribs, breastbone, and the dorsal vertebrae, and containing the chief organs of circulation and respiration, which is the chest. So first, we need to review the client's previous medical records and doctor's order sheet if available. This is done to identify the patient's instances of harm from medical histories. So next, we need to determine the scope of assessment needed, which includes the assessment for posterior and anterior thorax and the lungs using the IPPA or the inspection, palpation, percussion, and auscultation. Of course, we need to prepare the necessary equipment, which includes the skin marker, the stethoscope, the metric ruler, the patient gown, and of course the working sheet and the pen. And prior to the demonstration, we need to perform hand hygiene to deter the spread of microorganisms. So good morning, sir. I am Charmidale Blanco. So I am going to be your student nurse for today. So can I verify if you are Jasper Indangan?
Yes, ma'am.
Your birthday is?
May 1, 2001.
Okay, so how would you like me to call you, sir?
I'm comfortable of Jazz.
Okay, Jazz. So are you all right now? Are you okay? Are you comfortable?
Yes, ma'am.
Okay. Jazz, now I am going to assess your thorax. I'm going to assess and examine it. So there are certain procedures that should be done. So I am going to ask and instruct you on what are you going to do. So you just have to take my lead and relax. So is that okay?
Yes, ma'am. It's okay.
Okay. So would you care if I am going to lock the doors to provide us some privacy?
Yes, ma'am.
Okay, so here is the patient's gown, so you can please change into that, sir. So before that, do you have any questions or clarifications?
No, ma'am.
Okay, so you can change over there. So now we need to survey the chest and respiration. So first we need to check for the signs of respiratory or problems with oxygenation, and we need to observe the color of the face, lips, chest, and fingernails. And also we need to palpate the suprasternal notch and note the position of the trachea. So Jazz, so can I touch your chest?
Yes, ma'am.
Okay. So I am going to observe the color of your face, your lips, your neck, and your fingernails. So, can I see your fingernails? Okay. Can you face over there? To the other side. Can you breathe in and out for me? Now we're going to examine the posterior thorax and the lungs. So first, we need to inspect for configuration. This refers to the overall structures of the chest. So while the client stands with arms at the sides, we need to stand behind the client and observe the position of the scapulae and the shape of and configuration of the chest wall. So Jazz, can you please stand up and turn around? Okay. So I'm going to touch your chest. Is that okay?
Yes, ma'am.
Okay, thank you. Now we're going to inspect for the spinal alignment. So this is to determine any abnormal curvature of the spine. So from the lateral position, observe the 3 normal curvatures, which are the cervical, thoracic, and the lumbar. Now we're going to assess for the lateral deviation of the spine, and we need to observe the standing client from the rear and have the client bend forward at the waist and observe from behind. So, okay, Jazz, can you please bend over? Okay, thank you. Now we're going to palpate the posterior thorax. So, of course, we need to assess the temperature and integrity of all chest skin. Also, we need to palpate all thorax areas for bulges, tenderness, or abnormal movement. So, Jazz, again, I'm going to touch your chest wall, okay?
Yes.
Okay, thank you. And now we're going to palpate the posterior thorax for respiratory excursion. This is to examine the movement of the thoracic diaphragm during breathing. So we need to place the palm of both of our hands over the lower thorax with our thumbs adjacent to the spine and fingers stretched laterally. So also we need to ask the client to take a deep breath while we observe the movement of our hands and any lag in movement. So, take a deep breath, sir. Okay. Another. Last one. Okay, thank you. Okay. So now we're going to palpate the thorax for vocal fremitus, the faintly perceptible vibration felt through the chest wall when the client speaks. This is to assess for increase or decrease of lung density. Now we're going to place the palmar surface of our fingertips or the ulnar aspects of our hand or closed fist on the posterior thorax starting near the apex of the lungs. And we need to ask the client to repeat such words as blue moon or 1, 2, 3. And now we're going to repeat the two-step, moving our hands up sequentially to the base of the lung, and we need to move symmetrically downward and out to cover the lateral portion of the lungs at the bases. And we need to compare the fremitus on both lungs and between the apex and the base of each lung. So Jazz, so please utter the word blue moon once I touches your chest wall, okay?
Yes, ma'am. Blue moon. 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 Blue moon.
Okay, thank you. And now we're going to percuss the posterior thorax. So this is to assess for lungs resonance. So we need to ask the client to bend the head and fold the arms forward across the chest. We need also to percuss the intercostal spaces at about 5 cm intervals in a systematic sequence. And we need to compare one side of the lung with the other and percuss the lateral thorax every few inches, starting at the axilla and working down to the 8th rib. So Jazz, can you please bend over your head forward and put your hands across your chest? Okay. So I'm going to percuss your thorax, okay? Okay, thank you. Now we're going to measure the diaphragmatic excursion. we need to use the percussion to identify the level of the diaphragm and measure the diaphragmatic excursion. So we need to percuss downwards from above and the expected level of diaphragmatic dullness and until the dullness is definitely heard. Also, we need to mark the level of the full expiration and had the patient inhale deeply and hold it in, and then percuss downward to the level of dullness and full inspiration and mark it. And also, we need to repeat this process on the other side and measure the distance between the expiratory and inspiratory levels of dullness. So, Jazz, is it okay if I mark your back?
Yes, ma'am.
Okay. So, can you please breathe deeply and hold it? Okay, exhale. So, inhale again and hold it. Okay. Okay, and the other side. Please inhale deeply and hold it. Okay, exhale. So another. Hold it. Okay, exhale. Okay. Okay, thank you. And now we're going to auscultate for breath sound. So this is to assess the airflow through the airways. So we need to place the diaphragm of the stethoscope firmly and directly on the posterior chest wall at the apex of the lung at C7. And also we need to ask the client to breathe deeply through the mouth for each area of auscultation. And using the symmetric ladder or the zigzag pattern used in percussion, we need to listen at each point of the breath sound during the complete inspiration and expiration and compare the findings at each point with the corresponding point on the opposite side of the thorax. And also we need to note the location on the chest wall where the adventitious sound are heard, and as well as the location of such sound within the respiratory cycle. Okay, so just please breathe deeply when I point the diaphragm of my stethoscope on your back, okay?
Yes, ma'am.
Okay, breathe in. Okay, breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe in. Breathe out. 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 Okay. Thank you. Okay, and now we're going to auscultate the voice sound. First is the bronchophony, and in this we need to ask the client to repeat the phrase 99 while auscultating the chest wall. So just please repeat the phrase 99 when I point the diaphragm of the stethoscope on your chest wall, okay?
Yes, ma'am.
99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. Next is the egophony. So we need to ask the client to repeat the letter E while listening over the chest wall. So now, utter the word E. Okay? Every time I point.
E. 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 E.
Okay? And last is whisper pictoriloquy. So we need to ask the client to whisper the phrase 1, 2, 3 while auscultating the chest wall. So just please whisper the word 1, 2, 3, okay?
Yes, ma'am.
Whisper only.
1, 2, 3. 1, 2, 1, 2. 1, 2. 1, 2. 1, 2. 1, 2. 1, 2.
Okay, thank you so much. Now we're going to assess the anterior thorax. So first, we need to inspect the breathing pattern. So this is various respiratory patterns have localizing significance in the patient with altered consciousness. We need to observe for the characteristic of the chest, rise and fall, and its rate. Also, we need to inspect for the costal angle and the angle at which the ribs enter the spine. This is to evaluate the expansion of the thoracic cage. So, Jess, can you please inhale and exhale for me? Okay, another one. Okay. So, mind if I touch your chest?
Yes, ma'am.
Okay, now we're going to palpate the anterior thorax. Using our fingers to palpate for the tenderness and sensation, we need to start palpating with our hands positioned over the left clavicle and move our hand to the left, from left to the right, and comparing findings bilaterally. So next, of course, we need to move our hands systematically downward toward the midline at the level of the breast and outward at the base to include the lateral aspect of the lung. So we need to repeat the sequence in palpating for crepitus and fremitus in the anterior thorax. Okay, Jazz, I am going to touch your chest again. Okay. Okay, next, we need to palpate the anterior thorax for respiratory excursion. So this is to assess the movement of the thoracic diaphragm during breathing. So we need to place the palm of both of our hands on the lower thorax with our fingers laterally along the lower rib cage and our thumbs along the costal margin. So we need to ask the client to take a deep breath while we observe the movement of our hands. So please take a deep breath from me, okay? Okay, take a deep breath. Okay, another one. Okay, thank you. Okay, next we're going to percuss the anterior thorax systematically. So this is to assess for the lungs resonance. So we need to begin percussing above the clavicles in the supraclavicular space and proceed downward to the diaphragm. We need to compare the lung on the one side and to the lung on the other side. Just I need to percuss your lungs again, okay?
So,
Okay, thank you. Okay, now we need to auscultate for anterior breath sound adventitious breath sounds and voice sounds. We need to auscultate the trachea, also auscultate the anterior thorax. This is to assess the airflow through the airway. So we need to place the diaphragm of the stethoscope firmly and directly on the anterior chest wall and auscultate from the apices of the lungs slightly above the clavicles to the bases of the lungs at the sixth rib. Also, we need to ask the patient or the client to breathe deeply through the mouth in an effort to avoid transmission of sound that may occur when nasal breathing. Also, we need to listen each side for at least one complete respiratory cycle. So, now I'm going to auscultate your chest wall. So, please breathe through your mouth, okay? Through your mouth. Okay, ready? Okay. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Okay, thank you so much. And so just that's the end of our assessment. So okay, sir, Sir Jasper. So this is the summary or the gathered information that we got throughout the assessment. Okay, so please ask or raise an question if you have. Okay. Okay, for the surveying the chest and respiration, so there's no respiratory distress. The color of the face, lips, chest, and the fingernails are all even and in good condition with no lesion noticed. Also, in examining the posterior thorax and lungs for the inspection for configuration, the scapulae are systematic and non-protruding. Shoulders and scapulae are of equal horizontal position. So for the inspection for the spinal alignment, so the spine are vertically aligned. The spinal column is straight, right and left shoulders, and the hips are all at the same height. So also for the palpation for the posterior thorax, the skin is intact, uniform temperature, the chest wall are intact, and no tenderness and no masses. Also for the palpation for respiratory excursion, it is full and symmetric thorax expansion during deep inspiration. So in palpation for vocal fremitus, so it is bilateral symmetry of vocal fremitus. There's a low pitch voice palpated. Also for percussing the posterior thorax, there's a resonance. The percussion notes resonate except over the scapula, and the lowest point of resonance is at the diaphragm, which is all good. And also the measure of the diaphragmatic excursion is at 5 to 6 centimeter, which is normal measure of the contraction of the diaphragm. And for the auscultation for breath sound, the vesicular breath sound, bronchial breath sound, and the bronchovesicular breath sounds are all good and normal. So, do you have any questions so far? Okay, let us proceed. So, in assessing the anterior thorax, so when inspecting the breathing patterns, it is normal breathing around 12 to 20 cpm. It is quiet, effortless respiration. And inspecting the costal angle, it is less than 90 degrees. The ribs insert into the spine at approximately 45 angle. So in palpating the anterior thorax, there's no tenderness or pain is palpated over the lung area with respiration. Also at palpating the anterior thorax for respiratory excursion, it is full and symmetric excursion. And in percussing the anterior thorax, the percussion notes resonate down to the sixth rib at the level of the diaphragm. And in auscultating for breath sound, there's no sign of an adventitious breath sound, which is all good and normal. Do you have any question so far, sir?
No,
So,
no.
that is the gathered data in our the examination. So, since there's no problem notice to be resolved, so just a suggestion, or I'll just advise you to just keep your body fit as it is and continue to work on your build, especially in your cardiovascular, to keep your thorax and lungs well and healthy. And most importantly is for you to keep your balanced food diet and incorporate fruits and vegetables in your diets. Okay? Do you have any questions, sir?
No, ma'am. No.
Okay. So, that's it for today. Thank you very much for your time and cooperation.
Thank you, ma'am.
Okay. So I wish you all the best. So, you can go there to change on your. We ended the interview. We need to done aftercare, and we need to perform hand washing or hand hygiene. And lastly, we need to document all the findings we gathered in the client's record.